The prostate gland, though small in size, plays a profound role in the health and vitality of men, particularly those over the age of 50. Roughly the size of a walnut, the prostate sits just beneath the pubic bone and surrounds the urethra, the narrow tube that carries urine out of the body. Because of its anatomical position, when the prostate enlarges or becomes inflamed, it compresses the urethra and disrupts the flow of urine. Men begin to experience uncomfortable symptoms: difficulty initiating urination, the need to strain heavily just to pass a few drops, frequent nighttime trips to the bathroom, or even aching discomfort in the lower abdomen, pelvis, scrotum, and perineum. If this condition, known medically as benign prostatic hyperplasia, BPH, is left untreated, it can progress to recurrent urinary tract infections, bladder stones, chronic prostatitis, or in more serious cases, prostate cancer. Modern medical research has shed light on the hormonal imbalances driving this condition. As men age, their testosterone levels gradually decline. At the same time, other hormones, including estrogen, dihydrotestosterone, DHT, and insulin, tend to rise. This imbalance disrupts the natural feedback system that regulates prostate tissue, leading to excessive growth and hyperplasia. While surgical procedures and pharmaceutical treatments remain central in advanced cases, science has increasingly highlighted the power of nutrition and lifestyle in both preventing and reversing the course of BPH. The prostate is remarkably responsive to diet. By consistently consuming the right nutrients, men can shrink an enlarged gland, restore hormonal equilibrium, and dramatically reduce their risk of complications. Among the most promising natural interventions are 6 specific nutrients: zinc, phytosterols, lycopene, green tea catechins, natural vitamin C, and lauric acid from coconut oil. Zinc is arguably the most crucial mineral for male reproductive health and prostate function. The prostate tissue contains zinc at concentrations far higher than most other organs in the human body. This mineral plays a direct role in hormone metabolism and the structural integrity of prostate cells. More importantly, zinc inhibits the activity of 2 key enzymes, aromatase and 5-alpha reductase. Aromatase converts testosterone into estrogen, while 5-alpha reductase transforms testosterone into its more potent derivative, DHT. Excessive DHT is the leading driver of prostate enlargement. By blocking these enzymes, zinc helps preserve testosterone while preventing abnormal increases in DHT and estrogen. Clinical trials consistently show that adequate zinc intake correlates with reduced prostate volume and improved urinary function. Nutritionists recommend an intake of around 30 mg of zinc daily. Natural sources include pumpkin seeds, watermelon seeds, beef, oysters, crab, lamb, and even dark chocolate. Including these foods in the diet regularly is one of the simplest yet most effective strategies for long-term prostate health. Alongside zinc, phytosterols, plant-derived compounds structurally similar to cholesterol, have shown great promise. Beta-cytosterol, the most studied phytosterol, is widely used in natural therapies for BPH. It not only improves urinary flow, but also lowers DHT concentrations and alleviates residual urine volume in the bladder. Some studies have even demonstrated improvements in quality of life comparable to prescription medications without the side effects. Phytosterols also provide cardiovascular benefits by reducing cholesterol absorption in the gut, a double advantage for aging men who often face both prostate and heart concerns. Excellent dietary sources include pumpkin seed oil, sesame oil, peas, soy products, and extra virgin olive oil. Men who wish to combine culinary enjoyment with prostate protection can drizzle pumpkin seed oil or olive oil over salads and roasted vegetables, effectively turning meals into preventive medicine. Lycopene, a carotenoid pigment responsible for the vibrant red color of ripe tomatoes, is another nutrient that commands attention. It is a powerful antioxidant capable of neutralizing free radicals and reducing oxidative damage, which is one of the pathways leading to cellular mutations and cancer development. Lycopene intake is strongly correlated with lower prostate-specific antigen, PSA levels, a biomarker used by doctors to screen for prostate abnormalities. Moreover, lycopene modulates hormone metabolism, balancing declining testosterone and rising estrogen in aging men. Interestingly, processed tomato products, tomato paste, sauce, ketchup, contain significantly higher concentrations of bioavailable lycopene than raw tomatoes, since heat breaks down plant cell walls and liberates the nutrient. Traditional dishes such as pasta with tomato sauce, hearty soups, or even homemade pizza thus provide not only comfort but also cancer protection. Watermelon and pink grapefruit are additional rich sources, offering variety to the diet. Green tea, celebrated in Eastern cultures for centuries, has earned global recognition for its medicinal qualities. Among its many bioactive compounds, epigallocatechin gallate, EGCG, stands out as a potent catechin with profound anti-cancer and anti-inflammatory effects. EGCG directly inhibits the 5-alpha reductase enzyme, reducing DHT formation, much like prescription drugs such as finasteride, but without pharmaceutical side effects. In addition, EGCG downregulates inflammatory cytokines and oxidative stress in prostate tissue. Population studies reveal that men who regularly drink green tea exhibit lower rates of prostate cancer and BPH progression. The recommendation is 3 to 5 cups daily, ideally brewed lightly to preserve catechins and consumed without added sugar. While too much caffeine late in the day may disrupt sleep, green tea consumed in the morning and early afternoon is a safe and beneficial routine. Vitamin C is another essential player, though it must be derived primarily from whole foods rather than synthetic pills. While supplements typically contain ascorbic acid, often only around 5% represents the natural form the body can fully utilize. In contrast, fresh fruits and vegetables provide vitamin C alongside bioflavonoids, enzymes, and other synergistic compounds that enhance absorption and effectiveness. Within the prostate, vitamin C acts as a frontline antioxidant, protecting delicate tissues from oxidative injury, supporting immune defense, and aiding hormonal regulation. Leafy greens such as kale and spinach, cruciferous vegetables like broccoli and cauliflower, and colorful fruits including oranges, strawberries, and kiwis are all superb sources. Cruciferous vegetables in particular supply indole-3-carbinol, which helps metabolize estrogen into less harmful forms, further improving hormonal balance. Daily consumption of these natural foods builds resilience against BPH while enhancing overall vitality. Lauric acid, a medium-chain fatty acid most abundant in coconut oil, has drawn increasing interest in prostate health research. Like zinc and EGCG, lauric acid interferes with the conversion of testosterone into DHT. By doing so, it prevents the excessive stimulation of prostate cell growth. Beyond hormonal regulation, coconut oil possesses antimicrobial and anti-inflammatory properties, offering systemic benefits for immune health. Replacing industrial seed oils such as soybean, corn, canola, or cottonseed oils with coconut oil or extra virgin olive oil is a crucial step toward reducing inflammation and supporting prostate wellness. This substitution also lowers exposure to harmful omega-6 fatty acid overload, which has been linked to both cardiovascular disease and metabolic dysfunction. Of course, nutrition alone is not sufficient. A holistic lifestyle approach is essential. Men must reduce or eliminate refined carbohydrates, sugars, and heavily processed foods, as these dietary habits deplete zinc and spike insulin and estrogen, exacerbating prostate enlargement. Attention to digestive health is equally important. With age, stomach acid levels fall, impairing absorption of zinc and other essential nutrients. Supporting digestion through mindful eating, Adequate hydration and possibly fermented foods ensures proper nutrient uptake. The liver also demands care, as it is central to hormone clearance and toxin filtration. Excessive alcohol, pesticide-laden foods, and medications damage liver function, indirectly fueling prostate growth. Dairy products should be limited, given their association with higher hormone exposure. Excess body fat, particularly abdominal fat, is another risk factor, as it promotes estrogen production and increases inflammation. Weight reduction through a combination of regular physical activity and dietary discipline can markedly improve symptoms. High-intensity interval training, HIIT, performed once or twice weekly, has been shown to boost testosterone while lowering insulin and estrogen. Lastly, intermittent fasting, particularly the 20.4 regimen, fasting for 20 hours, eating within a 4-hour window, can reduce liver fat, restore insulin sensitivity, and promote hormonal balance, all of which positively impact prostate health. Taken together, these strategies reveal a compelling truth. Prostate health is not solely a matter of genetics or aging, but is profoundly shaped by lifestyle choices. By consciously incorporating 6 powerful nutrients, zinc, phytosterols, lycopene, green tea catechins, natural vitamin C, and lauric acid, into the daily diet, men can actively shrink an enlarged prostate, stabilize hormones, and defend against cancerous transformation. When paired with mindful eating, exercise, weight control, and toxin avoidance, these measures form a comprehensive blueprint for safeguarding prostate health well into the later decades of life. The prostate, once seen as a silent vulnerability of aging, can instead become a testament to the resilience that informed choices and disciplined living provide.